The content of this podcast does not reflect the views and opinions held by anyone involved. We will frequently be playing the devil's advocate strictly for the purpose of exploration of ideas and not as an endorsement of any subsequent action. We condemn all acts of violence other than those of self-defense against physical harm. Now, let's start deeping. All right, we have a nice fun topic today. Should be easy. Healthcare. The ethics around healthcare, morality, its practicality in different systems of management, whether that be government management, capitalist management, whatever we can think of. So let's start the topic off at, I think, an axiom that most people would agree with, but is in itself an axiom. Do people have the right to live?
I personally think that they do. It is definitely one of those things where the right to live is very basic. If you're not alive, you can't really do much else.
Do people have the right to do things?
I mean, we definitely want people to be able to do some things.
Arguably, there are people that view humanity as a whole as a cancer on the planet, with environmentalism, our effects on the environment, just the way that people act. There are groups of people that believe humans should no longer exist. That's how you get cults with mass suicide that would say, no, I don't think that people should actually have a right to live. So should we assume moving forward that the goal here is to keep people alive in general? Is that a good starting point?
I think that's definitely a good place to start.
Okay. So we want to keep people alive, and we want to figure out the best way of keeping people alive. And I would say, arguably, not in pain.
Yep,
so
I agree with that.
Not actively dying, not in agony. They are alive and at least able to function in some capacity. That should be the goal of a healthcare system.
I definitely agree.
Okay. Should healthcare include assisted suicide in that case? Because if the goal is to keep people alive, it shouldn't include assisted suicide.
I think that's where things get a little bit tricky, because I think that assisted suicide is definitely something that we should have. If somebody has, say, an end-stage cancer, where they're not going to live very long and their current quality of life is terrible, why should they keep living when nothing is really going to help their pain?
Okay, so not only keeping people alive, but having a certain quality of life. And if you fall below a certain quality of life, then it's probably no longer, not reasonable, but maybe a lower expectation of maintaining your life if you have a low quality of life, because it's not really worth living.
Right.
Whose choice should that be?
I think it comes down to the person and their family.
Okay, why their family?
Well, because in some cases, if I was, say, in a coma or something where I could not make the medical decisions for myself, a lot of those decisions would go down to my family.
Sure. What if the person is not incapacitated? So, for instance, just direct suicide. Should a person be able to kill themselves regardless of their family's input? If they believe that they are in a low quality of life, low enough to end their own life?
Yes.
Okay. And I think that in itself is large enough for its own topic.
Yeah.
But it's related to healthcare, so I wanted to at least touch on it. So, all right. Suicide is kind of a wishy-washy area. We'll cover that in another episode on its own. But for the most part, in terms of healthcare, let's focus on keeping people alive and maintaining the quality of life. Fair?
I think that's very reasonable.
Okay, so anything that involves directly killing someone, while it is a part of healthcare, we'll leave that for another episode. So we want to keep people alive, maintain a certain quality of life. Quality of life has been improving over the years, especially if you look compared to 300 years ago, where life expectancy on average, I think, was in the 30s or 40s, and now it's in the mid-70s, and in some places in the world you can expect up to the 80s. We've almost doubled our expected lifespan, and our quality of life has gone through the roof. Pretty much anywhere you go now in the world, with some exceptions, but in first world nations, you can generally expect air conditioning pretty much wherever you go, which is a huge quality of life, refrigerated food, fresh food. And you have a large quality of life. And generally with healthcare, like I lost a leg, but I can still walk around with no pain. So what is that minimum quality of life that we should aim for in a healthcare system?
I think definitely pain is something that we should look at, especially with, in some cases of cancer, it can be very difficult to prescribe enough painkillers for that person so they can live reasonably.
What do you mean by live reasonably?
So if their pain is at very high levels, they can't go out and do things. If it's down at a reasonable level where they are comfortable with it, it's not necessarily forefront on their mind, then they can go out and make the most of what life they have.
Okay, so we should allow people to live without pain.
Yes.
I disagree with that. So we're making progress. We finally found a spot where we disagree. I don't think that people should live without pain, because pain tells us information about the world and it basically tells us how to act. If you're walking in a particular way and it makes your ankle really sore, while we could just take painkillers, it doesn't solve the problem. The pain tells us, hey, you're walking in a way that's bad and it's causing wear and tear on your ankle. So if we just take the pain away, we don't solve the problems. We cover up the problems and ignore them, allowing them to get bigger. I think that an excess of pain is bad, but some pain is not. And in a lot of cases, especially in rehab is difficult because you have to go through pain, particularly with drug addictions. When you're getting rehabilitated, it's not that you're allowing them to not feel pain. That would be just giving them more drugs. You need to push them through the hardship of getting off of the drugs, which is healthcare that actually creates more pain than if they were to otherwise stay on drugs.
That is definitely true. I think that's a different side of pain.
Okay.
Because I've definitely been there. I had to do physical therapy for my knees because if I just let the pain be and not changed anything about my lifestyle, I would not be able to walk.
Sure. Now, you mentioned changing something about your lifestyle.
Yes.
So should a requirement, if painkillers are going to be used, should it be a natural expectation to also include rehabilitation?
I would definitely like that to be the case.
Okay. Who should enforce that?
I think it should be actually on the doctor. It sounds a little bit weird, but the idea being that the physician who is prescribing these painkillers also works with their patient to get them in a better state. Now, I know that the patient themselves are not going to be able to just go out and necessarily magically have this thing happen so that they've changed their lifestyle. Lifestyle changes are extremely difficult.
Mm-hmm.
But I think having a physician involved can definitely help push it a little bit.
Okay.
And I think also having the patient be involved as well is important. Because if the patient doesn't want to do this lifestyle change, then nothing's ever going to get better.
And I agree with that. I think now, is getting better a requirement, particularly in old age? Because as people get older, their lifestyle isn't going to get better. It's just going to, our goal is to decrease the rate at which their life deteriorates. So it's either get better or slow the degradation.
Yes, I would agree with that.
And I think that that's fair. That should be what our healthcare procedures aim to do. Slow the degradation or increase the rate of recovery and not just aim for stagnation. We should aim for a decent quality of life. And we're going fairly in depth into this, and these could probably be topics on their own, but I'm aiming to build up to what are the aims in a system before we actually start talking about the systems. So hold in there, guys. We're getting to it. So we want to improve the quality of life and try to extend life as much as possible. If someone gets to the point where they're below a certain quality of life, perhaps taking away the care such that they die naturally when their life is no longer worth living. For instance, I've had relatives that have Alzheimer's, have problems with their legs to the point where they can't walk, have heart problems. They really can't do anything other than sit there. And because of Alzheimer's, they have no idea how to do anything. So they really just sit in a room all day. And it's the type of thing where if I were in that position, I probably wouldn't want to be alive. But those people may not recognize how bad their life is because of the short-term memory loss. So it's difficult to say when people should die. But I think in any healthcare system, that is the question that you're really trying to answer. When should people die? Do we agree that death is something that, for now at least, is unavoidable?
Yes.
It'd be nice if we, maybe it would be nice if we could get rid of death, but death is not unavoidable. So would you agree that a healthcare system decides when people die?
I think I agree with that to a point.
What point do you not agree with it at?
I think there are some cases where it's not necessarily the system that determines when someone dies, but their circumstances. Because we have a lot of therapies and medications that can help people with, say, really late stage cancer, but people may not be able to afford it or be in a place where they could even get it in many cases. Say it's experimental.
Mm-hmm. So here we're getting into the meat of the issue of, should people be able to afford it? What if people can't afford it? How do people afford it? And this is where we get to the really two main talking points of government healthcare or single-payer healthcare, or complete you're on your own, which is no health insurance, or health insurance, which would be, I guess, capitalistic. So you're on your own, capitalist, and government. I think that those are really the three main ways of paying for healthcare. Would you agree with that?
Yeah.
What do you think is, from just as a starting point, what do you think is the best way to go about healthcare?
I think that's kind of tricky, but I would like to see single payer.
Why?
Mostly because it helps put everybody on the same playing field.
Okay.
Everybody has access to the same services, the same medications, similar levels of doctors, and they would all not necessarily need to worry about paying for it. They would all be paying the same amount. You know, like if they went in for a simple office visit, the copay would always be the same, if there even was one.
Okay. I think that single payer is one of the most destructive things that can exist in healthcare. I think that it decreases the quality of life of all individuals and decreases the rate at which healthcare improves. So I think it's one of the worst things to happen to healthcare. And I think that this is where we disagree.
Yep.
So you talked about a level playing field.
Mm-hmm.
In a capitalist society, do you think that does a capitalist society with capitalist healthcare not have a level playing field? Does everyone not have access to the same healthcare?
I think that is certainly true.
What do you mean by access?
Mostly involved in specialty care. For example, I probably have better access to, say, a dermatologist and can get an appointment with one significantly easier than my parents.
Is that because of where they live?
Yes.
What would change about that in a single payer system?
Then we would be more likely to have our specialists a bit more spread out. And we could say, hey, we need, say, dermatologists in this area and give more incentives to move people there.
Okay. But you're artificially creating incentives, whereas in a capitalist healthcare system, the incentives are there's money to be made here. If there's money to be made here, then, hey, maybe we should set up a dermatology clinic, which is what a lot of hospitals do in capitalist societies is, hey, here's an area where people have to drive 45 minutes. If we build a clinic out there, we can extend our reach to those people. And if they need additional specialty care that isn't provided by that clinic, then we can have them transfer over to our hospital. It's a risk, but it's a way of looking at where the need is, and the incentive is the people, as opposed to in a single payer system, the incentive is we want to spread it out to people, and it's not for any other benefit besides the feel good of everyone has access to everything. I think it becomes problematic with, to what degree do you spread things out? For instance, MRI machines. Those are really expensive. It'd be great if we could have an MRI machine in every city. Or every town with...
Yeah, I was going to say, I feel like we probably do have them in every city, but there are a lot of rural areas where the closest MRI machine could be hours away.
Right. To bring up a specific example with MRI machines, Canada has far fewer MRI machines per capita than the United States. Now, they have fewer people, and they may be more concentrated, but MRI machines in Canada are notorious for having very long wait times, to where you may be waiting weeks or months to be able to get into an MRI machine to get the scans that you need done. And the reason for that is basically the goal of a single payer system, particularly with government paid system, is to minimize the cost while also providing care. You want to care for as many people as possible while minimizing cost. And in order to do that, you need to have the bare minimum number of machines necessary to get people through without drastically decreasing the quality of life. For the MRI machine example, if you have MRI machines and you don't have a line for them, it means that you're tying up capital. And it could be viewed as wasteful, which means that in a single payer system where you don't profit, or the goal isn't profit, the goal is just to be as efficient as possible, you intentionally make sure that there are some lines to get the resources, which means people don't have as ready access to those resources, which is why in pure socialist healthcare systems, there are almost always wait lines and shortages of the healthcare that's actually needed.
So when you say actually needed, are you referring more to emergency situations or cases where it wouldn't hurt to wait a month or two?
Both. If you go into a hospital, I've seen hidden camera recordings of this when you go into a hospital in Canada and you say, I have a broken arm, or something along those lines, where you should be going to an emergency room. You can wait for 3 to 4 hours, depending on, for a broken arm, you may wait for 3 to 4 hours before you get taken care of. Like even to see a doctor, and they'll sort you by severity. But generally speaking, if you plan to have the minimum necessary, it means that you are going to have lines. And if you're going to have lines, it means that people are going to be waiting, which decreases the quality of the care.
So is it just because they're waiting that it's decreasing the quality of the care?
If you broke your arm and you're sitting there with a broken arm, no pain, with lots of pain and no attention, you don't know how badly it's broken, and you're just sitting there waiting for 4 hours, that's going to feel like an eternity. And that is a really bad position to be in. Would you agree with that?
I would definitely agree with that.
If you go to an emergency room, you would expect to be treated.
Yes. I wouldn't necessarily expect it immediately, though. Even in the U.S., we can have really long wait times in our emergency rooms.
You'll still be in a queue, waiting your turn. I think that's fair. But generally speaking, with capitalist motivations, if your goal is to make money, if you have a line, it means you're not making money. It means that there are people waiting that you aren't actively making money off of, which is why I believe the MRI per capita in the United States is higher, because they want to make sure that there are not unnecessary lines, so that they get the highest throughput possible, as opposed to the minimum necessary throughput possible in a single payer system. And don't get me wrong, in a single payer system where the goal is efficiency, that is a good goal. You want to make sure that you're not wasting people's resources, especially when it comes from taxes. Giving better healthcare does not improve taxes. Arguably,
it can to a point.
Keeping people alive does. I'll grant that. But it doesn't directly increase tax revenue. So their goal is to treat people and not to make money, which sounds like a good idea. It sounds nice, right?
Yes.
But nicety isn't practicality. If as an example, in Soviet Russia, there were hearings for engineers. The engineers were being sued by the government for being wasteful. And the government basically said, why did you spend all of this money on an air circulation system? The engineers designed the air circulation system to be good enough for the warmest day, so that the workers could continue to work even on the warmest day. And the judges basically said, that's wasteful. You're tying up capital unnecessarily. Those warmest days, who cares? Let the workers sweat. That's what they're built for. And who cares if the quality of life decreases a little bit? It means that you can put that money towards something else. And I think that that's the problem when you have government paid for healthcare, is you go for the minimum as opposed to going for the maximum profit, because maximum profit allows you to put more money back into the system, and make the most money, which I think people who earn the money at least have a reason to earn the money. And if they're earning more money, it's because they're caring for more people. So while it isn't a direct goal of caring for more people, the goal of a single payer system is not to care for more people. It is to care for the minimum necessary people, or provide the minimum necessary to care for as many people as possible. So I guess my question back to you would be, how is a single payer healthcare system better aimed at providing care for more people and not just saying that we want to care for people? How would it be more successful than a capitalist solution?
Part of it comes down to the capitalist solution being difficult for people to afford. In a single payer system, if I was to show up in the emergency room, I know exactly how much I would need to pay, if anything, and I'm not necessarily worried about, say, if I have to have an ambulance ride to the hospital, that's going to bankrupt me. Yes, I would have to wait for some of the non-essential things, but I think that the waiting for the non-essentials can be worth it for some of that peace of mind if you are in a catastrophe.
Okay. Are you entitled to that peace of mind? Do you think that all individuals, regardless of their quality of life or the position in life that they're in, whether they're high class, low class, rich, poor, do you think that all people are equally deserving of having that knowledge of, I'm going to the emergency room, I'm not going to have to worry about this cost? Do all people deserve that?
Yes.
Why?
I think that comes kind of down to the value of people, which I know is something we're going to explore later on.
That'll be a fun episode in itself.
But if you're thinking about all of these people as being equal, then the rich and the poor are really the same at their core. Why should the rich person be able to have more access than the poor person if you consider them equal?
Because they're more valuable.
But
they are by definition more valuable because the reason that they have more money, and I realize that with inheritance, there are different reasons that people can have money, but for the most part, in capitalist areas, you have money because you are doing something for society and you are making a contribution. The return on that contribution is the fact that you're earning money. And if you have more money, it means that you're more valuable to society, so you should receive better care.
But it can also be really hard to come out of poverty. Oftentimes, the class you are born into really puts a damper on everything you can achieve later on.
Yeah. And guess which system of governance or system of making money and managing resources has been the best at bringing people out of poverty? Historically speaking. You want to make a guess?
I'm sure you'd say capitalism.
Yes. And again, let's take Russia for example. Russia had some capitalism and then they went full communism. In the early 1900s, all the way up through the late 1900s, they went full capitalist. And I'm sorry, not full capitalist. They went full communist of no capitalism. Capitalism is bad. Capitalism is evil. And poverty rates just skyrocketed. People wanted to get into bread lines and could barely even get bread. If they got into a bread line and stood there for 2 hours, they might get bread. I would say that's pretty bad poverty if you need to spend most of your day just waiting in line in hopes that you get basic bread. With the inability to get bread. If people had their own resources and made bread, they would be arrested. So I would argue that that's really bad poverty. And if you look in the United States, even the lowest classes of people, or the most impoverished people, still have air conditioning. They have refrigerators. They can walk down the street and get food. And if they can't afford food because they are unemployed, we have some government systems, and I acknowledge they are social systems that are a safety net, but Even the most impoverished people in the United States and other capitalist societies have a very high standard of living for all people. As life gets better for the rich, in capitalism, it also gets better for the poor. Is that the same in socialist societies?
I think it's a little bit different in socialist societies because you're not going to have as much of an inequality between the rich and the poor.
Does that improve quality of life?
I think it can definitely improve the quality of life for the people on the lower income brackets.
Okay. And by the way, we'll bring this back to healthcare. I have somewhere where I'm going with this. And your argument, I'm guessing, is redistributing the money benefit from the top people and bringing it into the bottom.
Right.
Okay. Let's take that for healthcare. There is a healthcare hierarchy that the rich people can afford better care than the people at the bottom. It's similar to capitalism in that regard. For the people that get the top end treatment, cancer treatment that costs $500,000, the really experimental stuff, particularly for like some brain surgeries and transplants, some of this stuff is really hard to do and it's really expensive. There are not enough surgeons to be able to perform some of these, or resources, just physical materials, to be able to give that to everyone that could possibly benefit from it. So in a single payer system, you want to care for as many people as possible with as efficiently as possible, which means you would not give anyone that bleeding edge technology. Would you agree with that?
Yes, that is definitely true.
Which means if you don't use the bleeding edge technology and you just use the minimum necessary, when do the boundaries of medical capabilities get pushed forward?
There's still going to probably be teaching hospitals and a lot of research institutions pushing it, but you're unlikely to see as many as we have in the United States today.
Right. And if you're less likely to see improvements in care, and you're just trying to keep up with the influx of people that are coming down with these diseases, and you're not improving the care, you're just maintaining the status quo of here's the healthcare that you'll receive. You don't need more than this, even though we have the technology to do better. It doesn't really matter as much because we need to care for more people and be more equitable. Therefore, you're going to get the minimum treatment. Oh, this isn't working. Okay, now we'll bump up the treatment. But that means that very, very few people will even ever get to the point of having that bleeding edge technology. And if you don't use bleeding edge technology, you don't push the boundary of how good of care you can make, which means that everyone stays at a flat line of care quality. Care doesn't improve and things stagnate. Fewer people live because the people that could get the better care in a single payer system where you aren't allowed to pay your way to better care, you're not going to get that better care. And that's going to bring the whole hierarchy down in terms of overall quality, because as, like you said, in the United States, we have done a lot of development of that cutting edge technology because there's a financial benefit to it. People will pay for it. If the government won't pay for those cutting edge technologies because they're too expensive for a single individual, what's the motivation to give better care?
Part of it can definitely be because they want to save lives. Oftentimes better care can mean better outcomes. People live longer, better lives. They have a higher quality of life.
Which we agreed at the beginning was one of the goals, is to live longer and better lives.
Right. So that can definitely be involved. But there isn't going to be nearly as much money. I can definitely concede that point, that there won't be as much money for this cutting edge research, so we're not going to see as much. We would be relying more on other countries doing this research, which is kind of what we see in the world today, where a lot of this research comes out of the United States.
Because there's a financial benefit to it.
Right.
And one of the arguments is for other countries that continue to get these additional cutting edge technologies, and the development has been done by the United States. They have access to these. And I think that that's the problem with the argument of, oh, well, these other countries have single payer healthcare. These other countries have government provided healthcare. Why doesn't the United States move to that? And if you do that, you take away a large portion, not all, but a large portion of that cutting edge development, which stagnates the quality of life improvements that we've been seeing from medical technology.
And it wouldn't just affect the United States, it would be much more worldwide.
Yes. It would be like the perspective to me of moving away from a capitalist system of healthcare development and moving the primary driver of medical improvements is like driving down the road and looking at the driver and saying, hey, none of us are driving. Why don't you stop driving? And then you get surprised when the car runs off the road and everyone dies. That's kind of the sound that it has to me. So I think that there are a lot of problems, obviously, with having a government-run healthcare system. So convince me otherwise.
I'll need to think about that for a minute. Okay. So if we were to try to make this single payer system better, how would you feel if we allowed some people with money to be able to go above and beyond what our single payer provided? Say we provided a specific level of care for everybody. Say you could have the basics met, we could give you some basic preventative care. If something comes up, you would be on a wait list for an MRI, for example. But if you had the money, you could jump the line.
That you can jump the line, not just get better care when you get to the end of the line, but jump the line.
Yes, potentially have, say, some centers specifically for people with maybe some private insurance or pay directly out of pocket.
So the idea is have an option for government-provided healthcare, but also allow other people to have private insurance if they wish, to allow them to get better care.
Right.
Okay, that would satisfy the need of still maintaining that cutting edge capabilities, because some people would still be incentivized to get that better care, to pay extra money for it, but you would still take away the need for a bunch of people that can't pay easily for their health care because you're giving them a certain baseline.
Right.
Who pays for that?
I think it would have to come out of taxes. Potentially, private insurance would be less than it is today because they wouldn't be paying for that baseline.
The baseline of people that aren't paying much into the system, but are still taking out a certain minimum level.
Right. So say I spent $500 on my health insurance this month. In a world with this hybrid single payer and private insurance, say 300 of that went towards the single payer. It was taken out as taxes, but then I only pay 200 for my extra private insurance on top of that.
Mm-hmm.
The single payer covers the basics, the preventative care, and a certain level of the catastrophic care. But if, say, I needed to go get an MRI for something that kind of bothered me but wasn't immediate, I could go use that private insurance to do so.
So you mentioned paying $300 for the single payer. That assumes that everyone is paying that $300, though.
Right.
And basically that is forced purchase of healthcare for everyone. Even for the people that are more impoverished, they would still be paying that certain minimum level, which means you're forcing them to pay for something that they otherwise maybe couldn't pay for. So do we make people who can't afford as much still pay that tax to receive that benefit?
I think so, but this tax would definitely be a different level based on your income.
Okay, so the people that make more money pay more of it, meaning that they're paying for the benefit of other individuals.
Right.
Is that ethical? Let me rephrase the question. And let's try and simplify it a little bit. Let's say that I have medicine. And let's go back in time. Back to medieval times where I have a medicine that I know works. Some bark or something. I think birch bark has been used. Willow, I know, like willow bark and parts of willow trees have been known as painkillers. I think that's what's used in, at least was originally used in aspirin. So that has been known as a painkiller. Let's say I have gone out and collected a bunch of birch bark for the purpose of medicinal use. Someone comes along, they're poor, they don't have the ability to pay. Am I obligated to help them because I have the resources, they are in pain, I can improve their quality of life? Am I obligated to directly give that resource to them to benefit them?
I would like to say so.
That I'm obligated to do so.
Yes.
Why?
Because you are looking out for the entirety of your society. If you only gave this bark to the very rich people,
Mm-hmm.
who's going to work the fields to get you food, who's going to bake your bread, things of that nature, they're not going to be the people who can afford it.
So the idea is that maintaining a certain minimum for the rest of society improves society as a whole.
Exactly.
Which is great in theory, but again, let's look at how it's been put into practice. And yes, I'm going to pick on Russia again. Great example of bread lines. The government had some bread reserves, and they tried to distribute it to a majority of the people to keep a large portion of the population actively working and try to uplift society. The whole goal was to reach the utopia where everyone works together and helps each other for the benefit of the society as a whole. The problem with that is then everyone stops trying to work for themselves. If you provide a certain minimum level of care, then people expect that minimum and don't have to work for that minimum. Resources currently are limited. There's a certain number of doctors, a certain amount of medicine. To continue with the willow bark example, I would have a limited amount of that resource. I collected it, I put work in, and if someone comes to me with no recompensation for me, what reason would I have to go out and collect more birch bark? Willow. What incentive would I have if they are just going to receive it?
You wouldn't have any. But what if some third party was going to pay you for that bark, for every person that came to you and got it?
That third party, in this case the government, needs to get that money from somewhere. And if I have those extra resources, it's probably because I'm paying taxes. So basically, I am paying the government to pay me to provide my resources to someone else.
Essentially, yes.
Which basically means that I am obligated to work for the benefit of someone else. And that's the whole idea behind communist societies, socialist societies, as well as socialist healthcare, is everyone is obligated to pay for the direct benefit of others. It's very distinct from roads. And I think that this is one of the other arguments that people make of, well, everyone benefits from roads. Why not healthcare? Because in healthcare, I can still directly benefit from those roads. I also benefit from the fact that resources can move on those roads, and I can benefit from those resources directly. With people, I am paying to improve the quality of life of someone else, which does not affect me in any way unless I directly work with that person. And I acknowledge that they are a part of society and I interact with society, but I am directly paying for that person's well-being, and it can be looked at as I have collected this medicinal material and I'm giving it directly to you forcibly by the government at the point of a gun. So what makes that right? What makes that ethical? Let's save this topic for a different one. I know that collectivism is something that we have as another topic, collectivism versus individualism. And that's kind of what we're getting at here is, do collective rights overwrite individual rights? Because that's a different question. That's a whole episode on its own. So let's move a little bit towards, let's assume that you have the resources. How should it be decided how those resources are used?
I think that can be a very tricky topic, because ideally you would want to distribute the resources in such a way that people would get the most value out of them.
Okay.
If you gave a knee replacement to an 85-year-old woman, she's going to get significantly less use out of it than a woman in her early 60s that is in really good health.
However, a woman who's in her 60s who needs a hip replacement may have other opportunities to improve her quality of life in other ways. An 85-year-old may have fewer opportunities to improve her quality of life. So the overall quality of life improvement that an 85-year-old would get is probably more than a 65-year-old. Although the duration of the improvements on a 65-year-old would be more than an 85-year-old.
Right. And that's why it can be tricky to distribute these resources. Especially, too, if that lady in her 60s, what if she was really active and that knee replacement, if she didn't get it, that would now make her essentially bedbound.
So how should we go about deciding how those resources are split up? Again, ignoring the idea of who is obligated to pay for them. Let's just say that the resources are available, and there are a certain number of resources, both in terms of time for doctors, as well as physical resources, medication. Let's assume it exists. Let's assume there's a set amount, and there are enough motives for people to go into those industries and continue working. How should it be decided where those resources go? Should it be neutral? First come, first serve.
I think that can definitely play into it some. I also think that we could consider things similar to the transplant list today. You know, there are only a certain number of organs available, and we have to decide who makes the most sense to get, say, a heart. You know, they look at factors such as age, lifestyle, if you're a smoker, do you have a support system to help care for you when you get out of the hospital? Could you keep up with all of the medications that it takes? And potentially do something like that for some of these other treatments, like a knee replacement. A knee replacement is a great example because it actually takes a ton of physical therapy after you get the replacement to go back to normal.
So you would want to maximize the benefit that a person would get, as well as the duration of that benefit that they would likely get, as well as how much additional resources is going to be on the system. If you give a new knee to someone in their 30s for an accident or something compared to a new knee for someone in their 70s, it's going to be a lot more rehabilitation cost for someone in their 70s.
Right.
Which basically means that the people that are most likely to get healthcare are the people that are healthiest and don't necessarily need it the most.
That definitely plays into it.
And also, you had suggested earlier the idea of skipping a wait line if people are more capable of paying through either private insurance or just on their own. Would that play into it as well?
I could definitely see that. Say, potentially, if you are on that base plan from the government, they have a certain number of a certain procedure available. And then they use specific criteria for that procedure to figure out who gets it at what time.
What if all of those resources are tied up in people who are willing and able to pay more? What if you run out of those resources?
That's tricky because in those cases, you wouldn't want the government to ever run out of those resources in the first place. You would almost have to say, hey, the first 100,000 knee replacements in this country are reserved for these people on this standard preventative government supply plan.
So have a certain minimum percentage, because, 100,000 for one country wouldn't work for another
Right.
country. So a certain percentage of procedures are reserved for government-provided care, and the rest is a free-for-all of whoever can pay the most, basically.
Right.
So a mix of government and capitalist healthcare. Capitalist and free-for-all healthcare, I guess, because, well, insurance would probably play into it, and that's kind of a voluntary system that people can buy into. So all right, so with that percentage that's available for the government, that means that someone is deciding who gets to benefit from those. For instance, one of the problems with the Canadian healthcare system, I think it was a couple of years ago, the Prime Minister needed a heart surgery and couldn't get it in the Canadian healthcare system, so he came to the United States to get the healthcare that he needed. A lot of people throughout the world have done that, coming to the United States because the outcomes of surgeries are better. The safety involved is also better. The quality is also better, which is why people come from all around the world to try and get care in the United States. Partially because of the problems of single-payer healthcare systems, that they don't provide as high of quality because they're trying to satisfy the masses. And like you said, for a certain minimum percentage, they're trying to satisfy that percentage. So when it gets too high, the opportunities for people who can pay, it takes that away, meaning you effectively don't have an open healthcare system. You just have a government healthcare system, which then comes back into the problem of minimized resources and not being able to decide who gets the care. So any percentage could become too much of a percentage depending on the demand. So as demand increases, at some point in healthcare, you are going to say this is too limited of a resource. Let's say it's something life critical, something that someone can't live without, like dialysis. If we get to a point where are too many people on dialysis or anything that is life critical, and you have to decide who lives and who dies, how should that be decided? This is the question of death panels. Should death panels exist?
Yeah. So if we want to...
Hold on, are you saying yes, death panels should exist?
I think you need a level of it.
Okay.
Because it kind of goes back to what I was saying earlier about how if you have to use your resources wisely, you want to make sure that you give them to the people that are going to use them the best and the most.
And the people that would be best able to utilize their lives, if it is granted to them, are the people that have made the largest contributions to the society, which are the people that have the most money, which brings us back to the idea that a free-for-all system, or where people can actually pay, get the care, they are the ones that should be receiving the care.
So somebody who is rich and doesn't take care of themselves at all, they don't exercise, they eat a terrible diet, they pretty much sit on the couch all day, and they weigh 600 pounds, is more deserving of dialysis than somebody who takes a lot of care of themselves and they just happen to have a genetic disease that causes them kidney problems.
It's a fair question. Keep in mind that I said the person being able to afford it. If the person sits on the couch all day, they're probably not making money and not making contribution to the society enough to be able to receive the same level of care.
But what if they had a large inheritance?
Okay.
A lot of the folks
Sure.
with a lot of money, it's family money. They didn't necessarily make it themselves.
Sure. And I'll grant that. That is a problem where if your goal is to provide the most benefit for society, money is not always a valid solution to that. Would you agree that in a lot of cases, and probably the majority of cases, people who have money have earned it?
Yes.
Which means that in the majority of cases, and with a few exceptions, the amount of money that you have is a good way of determining whether or not you should get care. What are the problems with having a death panel? Can you imagine any problems, and how bad would those problems be with a death panel? Think of the worst possible thing that you can think of. I'm curious what you come up with.
I think it'd be terrible in a lot of those cases where we do have to ration care. Say we had to do a brain surgery and it came down to two people who were actually both very healthy otherwise and who looked pretty much the same on paper.
And that will happen of really difficult, really close circumstances.
Right. And in those cases, you have to pick which one lives and which one dies.
Mm-hmm. I don't think that you're thinking severe enough. Let's say that we do set up death panels. And it's something that exists in healthcare systems where there are single payers, and you have to decide where the care goes. There are people that decide that, and eventually it comes out down to someone deciding, yes, this person gets care, no, this person doesn't get care, or there are policies that put that in place. Which means there is someone or a small group of people that is making those final decisions. That puts a lot of power. It literally puts the power of life and death into individuals' hands, and not just the power of life and death over yourself, but the power of life and death over others. The people who are willing to take on that responsibility are the people that are willing, by definition, to use that power. And generally speaking, those are the most dangerous types of people to give that power. If you are comfortable saying this person lives, this person dies, and that doesn't bother you, there's a lot of opportunity for abuse in that system. In particular, do you want people who have their own biases and may be racist against individuals or may have a hatred for a particular group of people? Do you want to give them the power to decide, I don't like the way that this person believes, or I don't like this person's skin color. And these are similar situations. Otherwise, there are two cases where they both need brain surgery, but this person has this specific skin color. I don't think that they're as valuable to the society. I'm going to give it to this other person. Do you actually want the government or government officials to be able to have that power?
If those government officials have all of that information, then they would even know who. You would have to anonymize this data.
Race is an important portion of that data because it changes what health hazards you have. African American individuals have a higher rate and a higher risk factor for cardiovascular disease. So when you're making decisions about heart transplants, for instance, you would have to take that into account because, okay, we could give a heart transplant to this person, but there's an almost equal case, but a person of non-African American heritage may have a better chance of surviving than a person of African American heritage because of their heart disease risk, which opens the door for the individual who is on the death panel to specifically ignore the needs of people of a particular race, in this case African American descent, and cause them to never get a heart transplant and therefore die, even if that person was able to pay.
So are you imagining this death panel as one person or a group?
How should that be determined? If it's a group that looks at every case and votes on that case, okay, but how many people? Because you're going to have cases for all kinds of things. You're going to have cases for cardiovascular, and even if you spend 5 minutes on a case, if you have 20 people or 10 people for each case for 5 minutes apiece, all day, every day, for the entire country, the lines are going to be enormous. You need loads and loads and loads of people to be able to look at each case. And if you have the larger the number of people that you have looking at each case, the longer it will take for each one, the longer the lines, the longer it will take you to actually get the healthcare you need.
That is definitely fair. And in that case, it is possible you are waiting so long you don't get the care at all.
Right. So it's like, oh, well, we avoided the racism problem, but now no one gets the care.
Yeah, which doesn't help anybody.
So how do you work around that? How do you solve? What would be a good way of solving the death panel problem in terms of limited resource of deciding who lives and who dies, while also avoiding the problem of not allowing those death panels to become systematically racist? And even if you do have 10 people, you could still have them all be racist if they just decide, hey, so there's a death panel just for our province. We really hate this group of people. I bet if we all try to get on that death panel, we could get a majority. There would be groups that would probably do that to try and protect what they view as, let's say, racial purity. Do you want to give that capability to people? Do you want to take the risk?
I think if we were relying on, say, that one province's group of people alone, that wouldn't work. If, say, you also had the group from another province, maybe spot check.
What do you mean by spot check? How often should it be done? To what degree? Because there are a lot of cases.
Yep, that's what makes it difficult. You would want them to go in and make sure that how they feel about that case is the same as this other province. Plus, then you also get the benefit of everybody across your country is using the same standards when they're evaluating a case. Because even though you have something on paper saying, hey, these are the things you look for, or you use your clinical decision making to say, no, I think this person is going to be better off than that one. That's from your own experience, and it may not necessarily match everybody else.
That's fair. So the spot checking idea, it would have to be blind and random samples, where you take examples of comparison cases, and one province or area makes a decision. You give that same set of cases to another group and see what decision they make, which can be problematic depending on how many cases you want to spot check. But I think it's reasonable to say, do some sort of spot checking as a verification that different groups are still coming to the same decisions. Oh, okay. That's plausible, but it becomes very much a bureaucratic nightmare. Because now you have to maintain the cases, see what the outcomes were, and even if you have consensus across multiple groups of individuals, it doesn't mean that that decision is right. It means that it's more likely to be agreed upon by a larger group of society, but it doesn't make it the best decision or the right decision. Also, because their goal is to push through as many cases as possible and make the decisions as quickly as efficiently as possible, because that's their job. The more that they can get done, the more care that people can get. But the more careful you are in doing that, and the longer you're going to take on that case, the slower you're going to be. And also in terms of care, I've spoken with doctors about what their most frustrating aspect of providing care is. And there's a pretty good consensus that it's the bureaucratic system, because the amount of paperwork that you have to do directly decreases the number of patients that you can see and the quality of care that you can give. So every time you add a bureaucratic system, it slows down the care, decreases the quality, and decreases the throughput. So to what degree should the government be involved in making those decisions? Because like you said, with the death panels, the more people you have, the more resources are tied up in making those decisions, and the longer it will take going through the bureaucracy, which increases the length of those lines, which again, since you want to minimize the cost of the healthcare, you want to definitely have lines so that you don't have resources that are not being actively utilized, which means you already have lines and you have a bureaucratic system that is now weighing down those lines in hopes of making sure that things are used efficiently.
But would this bureaucratic system be worse than the insurance system we have today?
What do you mean?
So today, if I needed some sort of more special procedure, I may have to get pre-authorization, go through a whole bunch of paperwork just to find out if it's even covered.
Mm-hmm.
And then find out how much I would have to pay out of pocket. And I may not even find out how much I have to pay until after the procedure's done.
And I would agree that it's probably a good idea to know how much the procedure would cost before you actually go through the procedure. I think that's a place where we agree on. So your argument is that the insurance companies also have their own bureaucracy, and that also weighs down the system.
Right. And I mention that because that's part of why I still have my wisdom teeth. It is a pain to get that covered because your dental insurance doesn't cover it. Health insurance doesn't cover it because it's your teeth.
It covers it if it becomes problematic.
Right, but problematic isn't necessarily the same between everybody. So if you were to talk to, say, my doctor, they would say my wisdom teeth are fine. But my dentist would say, hey, they're in a spot where you can't clean them well. They're going to cause you problems in the future. It's actually safer for us to take them out now.
So have you thought about just paying for it out of pocket?
That's not something I can easily afford.
In which case, you are putting your money towards a different priority, and you don't get the procedure. So with insurance, it is a method of making it easier to pay for things. You can pay for things yourself. You could also just save up the money instead of paying for the insurance. Just start saving the money. And if that money runs out, oh crap, okay, now I can't do these procedures anymore. The idea of insurance is not to be the only way of paying for things, but to make it easier to pay for things, because you don't have to be the person to have that capital actively available and on hand. That's the idea of an insurance company. And yes, there is definitely a bureaucracy that is attached to that to make sure that they're spending the money efficiently, because they want to make money and they want to be able to provide care for individuals that need it, but make sure that, yeah, this care is actually necessary. For instance, wisdom teeth, from the insurance company's perspective, are they causing you problems? No. And it's possible that in the future they don't cause you problems. There are people that have their wisdom teeth and they aren't problematic. So as far as the insurance company is concerned, it is not worth paying the money now just because of a risk. That, risk is everything in terms of how much you're paying for insurance, which is why pre-existing conditions are a thing. If you're a smoker, that's a pre-existing condition because you are significantly more likely to need more resources, which means you're going to have to pay more for that medical insurance because you have a higher risk of ending up using it. It would be the same thing as saying, I'm a smoker, so I know that I'm probably going to have more health detriments later on in the future, so I'm going to start saving up more money for myself. It's a very similar thing that Yeah, there's a bureaucracy around it, but that is specifically for the benefit of the people that are paying for it paying less. If there was less bureaucracy, they would be more wasteful, which would cause them to need to raise their rates. So there's a direct detriment to increasing the bureaucracy. Increasing the bureaucracy means that you decrease the amount of care that people get and decrease the likelihood that people will take your care. So you want to minimize the bureaucracy. And as you minimize the bureaucracy, you increase the cost, which would increase the initial cost of the people that are buying into the system. So yes, there's a bureaucracy, but there is a natural balance to wanting to find the happy middle ground of that bureaucracy. So it keeps it in check. What keeps the bureaucracy in check in the government?
Well, that is definitely going to be different than the insurance companies.
And how would it be?
So right now, with the insurance companies, it's mostly kept in check by people actually buying their insurance.
Mm-hmm.
If you're not happy with your insurance, you can change it to something else. But with the government, you don't have that option. It's just the government in charge of everything. The best you can do is petition your representatives in the government to try to make things better.
So basically what you're saying, and I'm going to throw it right back in your face, what you're saying is, in response to me saying that the insurance companies have a natural balance of bureaucracy because of free market. Oh, well, you're inefficient and I can't get good care from you. I'm just not going to buy it. The best you can do for the government being inefficient is saying, hey, please stop being inefficient.
I mean, that's about all you can do as a person, unfortunately.
And that sounds better to you than going to a different insurance company?
I mean, it depends on how efficient the government is as well.
You know, one of my favorite jokes, you ready for this? Your local government uses your tax dollars efficiently. Oh, I love that joke. But when have you known government to be efficient?
I'll admit, they aren't entirely efficient because a lot of areas do not talk to each other well and they just do not keep track.
The DMV is specifically known for having ridiculously long lines and being horribly inefficient and being a nightmare to go to. That's where people probably most frequently interact with the government is the DMV or getting a license or a passport. It is horribly inefficient because they have to care for so many people and they have to have the bureaucracy to be able to do that. So in what way, I understand that bureaucracies are going to come up either way in a private or in a social healthcare system, but in what way is the bureaucracy that is associated with government paid healthcare better or more efficient than a private one?
Probably the biggest thing is just going to be how many different people need to look at the paperwork. If you're just dealing with the government, that is only one person. But with the insurance companies, it'll get passed around to various people for prior authorizations and similar things to determine if you can have this thing in the first place. I understand that there will be some level of that with the government too.
And I think that's the point that you're missing out on is that in the government, it's like, okay, this needs to go to a certain person. All right, well, how do we know that it's actually supposed to go to that person? Well, you need someone else to look at it and basically triage where that should be going. That will go to another person. It may end up going to the wrong location, but even if you assume that it goes to the right location, a lot of times, like we said with the death panels, it should require more than one pair of eyes to make sure that there are no mistakes being made, which is where these pre-authorizations come from, particularly in the insurance company, is to make sure that no mistakes are made. If you only have a single person doing that, you're more likely to have mistakes, which means that you should have more eyes on it, which is exactly what the government does, is they have more eyes on it, which is one of the reasons that it's inefficient. My question is more of what benefit is there for the government to increase the efficiency and effectiveness of that bureaucracy? I recognize that the efficiency is, well, for the sake of mankind, I guess, that you want to improve the quality of care. Okay. So that is their sole motivation. They don't really care as much about the money because it's coming from the taxpayers anyway. So they don't get a direct financial benefit from increasing the efficiency. They only get the moral benefit.
I mean, there's some financial benefit to it because if they increase their efficiency, they can process more applications and care for more people.
They're not profiting from those applications.
No, they just have more money to spend on the populace.
But it doesn't increase, like, giving someone care doesn't increase the amount of money that you're receiving. You are just you're allocating resources.
It could increase the money that the government is receiving, because by keeping the populace in better health, they can work harder, they take fewer sick days, and earn more money.
And the most efficient way to do that would be giving as much resources as you possibly can, and the best resources as you can, to the people who are contributing the most to society, which is the richest people. So if you follow that logic, the bureaucratic system of government, in order to be most efficient and make the most money back on their taxes, would be to give the best possible health care to the rich free of charge.
I can definitely see that. Partly because there's so much inequality in the U.S. right now. Most of the wealth is concentrated in just 1% of the population. Well, actually, clarifying that a little bit, it's the top 1% of people in the United States have 40% of the wealth.
Okay. Which means that, so are you saying that we should be giving the best possible healthcare to that 1% because they have 40% of the wealth, which means that and that's not going to be just inherited. They don't inherit 40% of the wealth. They're generating wealth for society. So should we just do our very best to keep those people alive because they're obviously doing something that gains value?
But part of the problem there is how many other people do not get care because you're giving it all to those 1%.
Well, it's 1%. There are only a certain number of people that can actually receive that care. So the number of people that you have to give that care is drastically reduced compared to if you want to care for 40% of the value of the society, the most efficient way to do that is to give it to the 1%. Because otherwise, for the other 60%, you have to care really well for 99% of the society.
So you would want your society to be just made up of those 1%?
No. Because that's not how hierarchy and distributions work. And this is another problem with that argument. Are you familiar with Pareto distributions or Price's law?
No.
Okay. So the Pareto distribution is also known as the 80-20 rule. And it's a much deeper problem than you think it is because capitalism has hierarchies. But hierarchies are not just a problem with capitalism. It is a problem everywhere. The 80-20 rule is the idea that 80% of something 20% of something accounts for 80% of that system. As an example, 20% of carpeting in your house receives 80% of the wear and tear because they're the most common walkways. I think it's something like about 20% of stars in the universe possess 80% of the mass. Is that fair? The question is ridiculous because it's completely irrelevant. There are a small percentage, and I realize that 20 is not 1, but 20% compared to 80%, that's a huge difference, and it shows up in nature, not just in capitalism, but in nature. Price's law is very similar. The idea that when you're producing resources, the resources produced are related to the square root of number of people producing. So in other words, the square root of the number of people making contributions produce half of the resources. So if you have 100 people, the square root of that, 10 people, will produce half of whatever they're working on. So authors are a good example, where if you have 100 authors, 10 of those authors will produce half of the overall books. If you scale that up to 1 million, the square root of 1 million is 1,000. So if you have 1 million people, 1,000 of those people will produce half of the resources that those 1 million people are working on. As a great example, if you are just doing anything that generates wealth, let's say you're making medicine, you're making pills, and you have 1 million people that it's just their job to produce pills and process medicinal materials. The top 1,000 people of that will produce 50% of that medication because they are just better at that production. Now, it's more valid in generation of new material than it is for factory workers. So for instance, in factories with 1 million people, you would expect it to actually be fairly uniform. But when the benefits come from new materials being created, and new inventions coming forth, it's the square root, meaning that if you have 1 million people trying to improve healthcare, the top 1,000 people, which is 1/10 of 1%, would be generating about half of those benefits. And that's not a bias. That's not something inherent in capitalism. That is just something inherent to existence itself. And it's not something that's intentional. It just is. It's a law of nature. Is that wrong? Should we try to stop that? Does that make sense?
It does make sense.
I mean, does it make sense to try and fight that type of natural law? Because I would argue that it's good. If the square root of the number of people that are trying to make contributions and new contributions, if the square root are the ones that are responsible for that, that means that 1,000 people are doing half of the work for 1 million. Yeah, it sucks for those people, but for the betterment of the rest of the people, they don't have to work as hard. They don't have to be as productive to still gain the benefits from those 1,000 people. The idea of the top 1% having 40% of the wealth, okay, that's because they're making 40% of the contribution.
But how much does everybody else actually see that contribution? A lot of those 1% are people who are more investors in large companies.
Let's take the richest person in the U.S., which I believe is currently Bill Gates, or at least he has been for a very long time.
He's up there.
Tell me, let's see, what contributions has he made? When was the last time you used a Microsoft computer? By gosh, I think we're using one right now, and we have been pretty much the entire day. Oh well, what about like cell phone? Oh right, I have cell phones too that have similar software heritage back to Microsoft. Interesting. The richest people, you see the benefits everywhere. Jeff Bezos, ridiculous amount of money. You know, related to Amazon, the thing that most people do a large portion of their shopping with now. Like, it's parts of your everyday life that, what's the value of Amazon to you? What's the value of Microsoft to you? Can you put a value on it, or is it just like an integral part of your life? That's why these people are rich, is because they provide something that becomes an integral, critical part of people's lives. So to bring it back to healthcare, should we just provide free healthcare for the people that benefit society most using the metric of money, of you have this amount of money, therefore you have that value to society, so you should get better care than other individuals?
I mean, if it is from the government, ideally the government is looking at equality and money doesn't play into it. But unfortunately, that is not how things work today.
Well, and that comes back to the death panel idea of how do you decide who would best benefit and how would we best benefit society? Your value to society has to come into it. How else would you measure how valuable someone is to society?
That is true. And I know with some types of transplants, it does come into it, is being able to pay for the treatment because it is a lifelong treatment.
Mm-hmm. And if you don't have the ability to pay, then do you deserve it? Here's a similar question. If you don't have the ability to pay, but you could be a benefit to society, should the government pay for you, or should you just be allowed to die? Because that's effectively the question that we're asking. And that comes back to our original question at the beginning. Do people have the right to live?
I would argue, yes, we should pay if that person is going to contribute to society. You know, if making them better turns them into somebody who will contribute more to society, then why shouldn't we?
That argument is so open-ended it could be used for anything. Well, this could be good, so why don't we do it? Sure, it could be good to save this person's life. They could also get hit by a bus and die. They could have some rare genetic disorder. There are an infinite number of things that could turn that around and say, well, yeah, they could. But if you start acting off of only what could be, then you start to embrace the utopian idea of, oh, we must do this so that we can embrace the utopia and bring forth the utopia. Again, to bring up Russia, I know this is like the 4th or 5th time that I brought up Russia. the ongoing joke amongst the peasants living in Russia was, oh, the utopia is always 10 years away. Oh, but 5 years ago it was 10 years away. I know. It's still 10 years away. And it was always 10 years away because life never improved. They never got to the utopia because life never improved. There was no reason to get there. And they were always acting off of, well, the hardship now will allow us to get to that utopia. So saying, you could have a benefit to society, therefore I am going to save your life and fight for your life for every fiber of my being. That is one of the most positively empathetic but negative results that you can possibly have. Because who is responsible for the care of an individual? And this is coming back to collectivism versus individualism of, should someone else be responsible for fighting for my ability to contribute to society, or should it be me that is fighting for my ability to contribute to society? Because if the answer is me, it means that you should pay for your own health care and not expect other people to pay or decide what health care you get. And if the government is deciding what health care you get, the government is deciding what your value is, and you now have no autonomy to decide or make an effort to change your value to society. You have a set value, and yeah, it equalizes everyone when the government decides how valuable of a person you are, but it equalizes everyone down because you no longer have the ability to determine what your value to society is. If you think that you're valuable to society and you want to bend over backwards to be able to pay for the care that you need to allow yourself to continue living a full life and make that contribution to society, that's on you, and you've proven yourself as a value to society, as opposed to the government being hopeful that they're making the right decision.
So, in an ideal world, the government would have paid for all of your preventative care, so then you wouldn't need anything catastrophic. They would have realized that you were headed down the path of diabetes before you had diabetes, and it's significantly cheaper for them to take care of you before you have diabetes and potentially prevent it from actually going to diabetes, so you can contribute more to society.
So the government looking after, hey, we should provide preventative care so that you are less likely to have worse healthcare problems in the future, because that is significantly more expensive. And we see this with people that don't have health insurance. They'll just not pay for health insurance, go to the emergency room, expect care, get paid for their critical care, and then leave.
Right. I had an uncle that only found out he had diabetes when he was in the emergency room.
Mm-hmm. So the idea of paying for preventative care and trying to determine when preventative care would be helpful.
Right.
So are you saying that it's the job of the government to babysit all individuals and say, I noticed that you're not acting super healthily. You should start eating better. Should the government baby us in doing that preventative care?
I think they have some role in it. A lot of people never got the education to find out, hey, this is what you should be doing. As we saw in Orange is the New Black, all those women didn't realize that women have two holes. Have you not watched?
I have no idea what you're talking about. I am aware that women have two holes.
Right, but in Orange is the New Black, they did not realize that urine does not come out of your vagina.
Mm-hmm.
And there's a lot of basic information that people just don't know about their health.
Mm-hmm.
So having the government in a position where they can at least help with those basics.
Basic health education.
Right.
Sure.
That can definitely prevent a lot of major issues going forward, and it would be cheaper for society overall.
So increase the education of individuals to help them make better decisions.
Right. And some of that
But it would still be up to the individuals to make those decisions.
Right. Unfortunately, I could not compel you to go to the gym with me every day.
Good, because I'm not going to. But that's kind of the problem, is you can't compel people to make good decisions. So when you educate people and they still make bad decisions, is it then the responsibility of the government that tried to educate the people to then say, well, you didn't do the thing that we told you to do. You were being dumb, but we're going to give you care anyway. Are they still obligated to give you care?
Honestly, I don't think so. I think if the government works hard to prevent you from going down a path that is going to lead you to a lot of bad problems, it's on you. You made the choice when you had all of the resources to turn things around.
Congratulations, you're a capitalist, because that idea is the government provides the education, which would basically be the public school system, and if you still make really bad decisions, the government should not be expected to pay for the healthcare that comes from those negative decisions.
I mean, to be fair, the public school system really doesn't do a good job of teaching healthcare and those related things.
And that's a topic that we can get into in a different episode, public versus private and just public education in general. But my point stands of, if people are educated and we have a general expectation of, hey, don't be stupid, and people then be stupid, how do we decide who gets punished? Because if that power goes to the government of, well, your punishment is that you don't get this healthcare, that comes back to the death panels of deciding who gets what. Can you decide based on their decisions? And do we give that power to individuals on a death panel, or do we just say, your life decisions led up to this, you don't have the ability to pay for this care, that due to your own mistakes or your own misfortune mean that you don't have the ability to get the care you need? Should we let nature take its course, or let your life decisions take their course on whether or not you can get that care, or do we give that to individuals to decide?
Well, I think in some cases, even if we had the individual decide, they still wouldn't be able to get care. A lot of cases, the morbidly obese cannot get care because it's too hard to operate on them. They've let themselves go so far that no matter what their choice is, they can't really do it.
It's not even a matter of being able to pay for the surgery. It's, you are so fat that we cannot get to your internal organs because there's too much fat in the way, in which case your bad decisions have literally killed you in a way that is not, you can't really work around, even if the government wanted to.
Right.
So for the people that have gotten to that point where they've made such bad decisions that they literally can't undo them, should other people who have also made similarly bad decisions, but for one reason or another, maybe they had heart issues when they were 300 pounds instead of when they're 500 pounds, should they be any less responsible for their mistakes? Or should the government say, well, okay, if you can operate, we'll forgive you for your mistakes? Because I think that doing that prevents, and not having people pay for their own healthcare, particularly for preventable healthcare problems, people will not learn from their mistakes. That's one of the, so for instance, the healthcare surgery for, what is it called? Where you constrict the stomach, gastro bypass. Doctors will not do that, even on very fat patients, until they have lost a certain amount of weight to diet. Because even if you restrict the size of the stomach, if you continue eating at the normal amount for a 500-pound person, that stomach will just expand out again, and it will continue to grow in size. The problem is not solved. It is supposed to help you not feel as hungry while you go on a diet. So you need to prove to yourself, to doctors already, that yes, I can diet, and I will diet. Please do the gastric bypass to make it easier. So even there, they won't even start down the road of giving you care until you've proven that you've learned from your mistakes. So the idea of, should the government assume that you've learned from your mistakes, or force people to say, look, you've made your mistake, you have to live with what you've sown?
I would be much more inclined to say that the government makes you understand your mistakes. So in that gastric bypass example, you have to lose weight first before you can get the surgery.
And should that be government mandated?
I would say yes, because otherwise that surgery isn't worth it.
Which is something that rule is based on capitalist methodology, because, well, if we're going to do the surgery, it costs us money, and if you're just going to come back, it's not going to be efficient for us. It's tying up our doctors when we could be helping other people. Believe it or not, doctors actually do want to help people. Yeah, even in capitalist societies, yeah, sure, we make money off of sick people, but the reason you become a doctor is not to, doctors are not twirling their mustaches and laughing, ha ha ha, I'm making money off of so many unfortunate people. They want to help people. That's why people become doctors. So the idea of, oh, you're not learning from your mistakes, therefore I'm not going to give you the care, should that be in the hands of the government, the doctors themselves, or just the ability of the person to pay?
I think realistically it's going to have to be on the doctors because they understand the patient.
They're the ones that are closest to the patient.
Right.
So then the government is not involved.
Right. Although, in the case of rationing care, that gets tricky.
Because maybe the doctor says, well, this person, I think, should have that care. But if you have a death panel or a resource panel, let's call it, run by the government, they may decide otherwise of, no, actually, we think that this person is better to give care for these reasons. So then you would have a difference between the opinion of the doctors and the opinion of the overarching bureaucracy or the government on who gets that care. And when you bring in the other idea that we had of the provinces or different areas double checking those decisions, now you have 3 groups of people double checking cases of who should get what resources. So now you have 3 groups of people instead of the one group of people that currently exists in capitalist systems, which is the doctors and the direct hospital that they're working for, essentially. That's what I mean by out of control bureaucracy is the more people you start involving in making that decision, the more problematic it becomes. There's the idea of distributed intelligence, that the decisions you make are the cumulative thought process throughout your life. And those decisions lead to certain results. The idea of natural selection, that if you made decisions that put you in a position where you can't get the healthcare that you need and you end up dying off, those decisions are what led you to that. And the ability of people around you to support you in getting the care you need. So for instance, with donations or family support, if you can't make it past that obstacle, it means that you aren't meant to get past that obstacle due to natural selection, distributed intelligence, whatever you want to call it. That is at least a neutral way of deciding and not risking giving too much power to individuals to say, I don't like this particular type of person, or I have these personal biases, and this is the decision I'm going to make. It gives control of people's own lives, despite the fact that it means that, yeah, some people will not be able to pay. They are at least in control of their lives, as opposed to begging the government for a decision that benefits them.
But are they really in control when they're already begging strangers on places like GoFundMe for money to get medical care?
It's an option that they have, and they can choose to do that as opposed to going into debt. Going into debt is a choice. Going on GoFundMe and asking people for money is a choice. Going to the government and saying, hey, can this be provided, is a choice if there is socialist healthcare available, depending on where you are. But for instance, with the GoFundMe example, people who pay that money are doing so voluntarily, as opposed to in the government, it would be all the other taxpayers involuntarily doing it. Would you rather have people voluntarily paying or involuntarily paying?
Well, if people are involuntarily paying, I'm much more likely to have the money to afford something.
Sure. But again, do you deserve it? Because in the GoFundMe example, if there's no reason for people to really help you out, if you're just some nobody that no one's ever heard of and you have okay, whatever story, like, hey, I have a liver problem, I need a liver transplant. Okay, but if you're well known, like a celebrity, people may be more likely to provide money, which again comes down to the idea of, should those resources go to the people who are richest or the most visible benefit to society, which the GoFundMe example is kind of similar, where you are more likely to get more money if you're more visible in the community and a larger benefit. So the people that aren't as large of a benefit, it's like, well, that's unfortunate, but you aren't as valuable to society now. And while you could be in the future, you have demonstrated that this is your current value in society. So why should we help you? Beyond what you yourself are capable of.
Yeah, and that is tricky as well, because so many people are stuck in poverty. Like, they can't get out. It takes money to get out of poverty. Yeah.
It takes a long time to get out of poverty.
Right. And so when you are in that situation, there really isn't much choice. It's go into debt, hope that people find your campaign on GoFundMe, essentially, or die.
Yeah. People die. some point or another, people will die. The question is when.
Right.
So if you are incapable of prolonging your life, should it be the government that decides, I think you're going to continue to live? Because it's not really it's not saying we are going to kill you. It's saying now is your time. Who should be in control of deciding when people just die? Because it's not a matter of if, it's a matter of when.
Right.
The question should it be society? Should it be the government? Or should it be the individual?
I would at least like it to be at the level of a society, if not the government. Partly because if you're looking at the individual level, say going back to that person in poverty who can't afford it, well, they have no options.
In capitalist societies, the people who are responsible are the individual primarily and the society, which is the whole idea of charity, giving to charity, and or giving directly to the person, for instance, in GoFundMe, or talking to your community members like, hey, I have cancer. People are going to be more likely to give you money if you've contributed to the community, but you can already do that in a capitalist system. Nothing is preventing society from helping you out. It's just at the society's choice as opposed to at the government's choice, which is forcing the society to do it. And if you want to have a better society, it would be encouraging people as a society to help other individuals voluntarily. The people who are more capable generally do. The people who have given the most money are the people who have the most money, not necessarily percentage-wise, but for instance, you look at who are the people that are most likely to donate money. It's not people that believe, generally speaking, who believe government should have control over everything. The people who are more likely to donate money tend to be more conservative, which tend to be small government. Because they still want to benefit other individuals. They still want to be compassionate to other individuals, contrary to what popular belief. But it's a voluntary giving of money as opposed to a forcible giving of money.
But would that voluntary giving of money be enough?
Doesn't matter. If we as a society are not generous enough voluntarily to help those who are sick and in need, then we don't deserve the benefits that those sick and needy people could bring to us. That is the punishment to a society that does not help the poor, is you suffer the detriments of losing the poor.
And is that something we're okay with? Because that's essentially what happens, is if you are a poor person, you are typically friends with other poor people, and you would be relying on their charity to help you. They're not going to have as much money to give you, so you are not going to get enough money for major surgeries.
Yep.
And so essentially, like, you would die, and other people in the community who are in similar situations would also die.
Yep. And again, if we as a society do not deem it necessary to pay for the medical care, then we necessarily reap the detriments that we sow. If we lose those people, we can't get them back, and we will have detriments. What those detriments are, who knows, but that is the penalty of having an open society where you have freedom to donate. If you force people into doing things, is it better than allowing people to choose things at the risk of not doing it?
Well, if nobody does it and it is something essential, then it is better to force people to do it.
Who determines what's essential?
I would argue it's a society that determines what's...
Meaning government plays no role.
Right, the society tells the government what is needed.
But why have the middleman? Why determine what's necessary when society donating to individuals that they believe will be helpful is, in effect, putting a direct vote on what we deem as valuable?
Part of it is society is just so big.
Well, it is the biggest a aspect of humanity that we have. Yeah.
Right. But like if you were to look at the US as a whole and one person in their small poverty-stricken community is sick, even if there are a lot of people in the US who want to help them, which is definitely possible, they're not going to be noticed and get the money that they need.
A famous quote comes to mind: "Ask not for whom the bell tolls; it tolls for thee." It's the idea from the Black Plague. When people were dying, they would ring the church bells when someone would die. And it's the idea of, well, someone else died, it's okay. No, it's not okay, because you are a part of humanity, and when one person dies, it decreases the human experience that you are a part of. And it's a moral argument to say it is right to help other individuals who are in need, because you move humanity forward. You increase the value of humanity, and therefore you increase the value of yourself. But it's, I think, up to people to do that, as opposed to the government to force people to do that. Particularly for the reasons that I've laid out previously, where the government is necessarily inefficient. They reduce the amount of cutting edge care that is provided. The knife that we can use to cut through diseases is dulled because we want to use it on as many people as possible. Not using a knife on people, using the cutting edge technology on people. You decrease the quality of care, and therefore decrease the ability to care for the population, and decrease the quality of life of people as a whole. It at best stagnates the quality of life through forcible pay of individuals that you would need to also determine who those individuals are. And in doing so, you become more bureaucratic, more wasteful in your spending. And it doesn't improve. It doesn't improve things. It only stagnates or makes things worse and less efficient. As opposed to, all right, yeah, if we're in a free market society, people pay for what they can. And when people can't pay for it, we have to rely on donations and charity to help those people through it. And it relies on people's inherent goodness to help others through things. I think it's a moral obligation. We have a moral obligation to help other people in need in whatever way we can. And in terms of like rehabilitation, maybe instead of having a government provided rehabilitation, the community says, yeah, I'll come over to your house once a week and help you out with these exercises. Or you'll encourage your friend to come to the gym with you. So I would argue that having a moral obligation and encouraging that is better than forcing people, because in order to force people, you have to have the bureaucracy to enforce it, and that immediately becomes less efficient. It is inherently inefficient. And the most efficient way is to have a moral structure where, hey, this is a good idea, and allow people to make that decision. It means that fewer people are probably going to donate, but they're going to do so voluntarily with none of the overhead of deciding who gets what, because that thought process is handled, like I was mentioning earlier, with the distributed intelligence. That thought process of, well, where does it go? It goes to whoever society deems deserving through the process of charity. Is there a reason why that you can see why charity would not be a better solution than forced government paying?
It just goes back to the idea of not having enough money.
There isn't enough money. There is never going to be enough money until we get to a spot in society where we are no longer a resource-bound society. There will always be limited resources. The decision is how we divvy up those resources.
It also dives into a lot of where society comes from. You do tend to get pockets where a lot of your charity comes from churches, which does leave out a lot of people as well.
For people that don't go to church.
Right.
Yep. Which gives a benefit to actually going to church. And if you choose to take that benefit and engage in that society, it's like buying health insurance in a way, because you're making yourself part of a community that you know will help you potentially live longer. If you choose not to do that, that is a choice that you've made, and it's a choice that you should have to live with if it's a mistake. if churches are give more charity and can help support each other more, should it be government mandated as preventative medical care to be enrolled in a church? Because there are health benefits, both in terms of just socializing with other individuals has health benefits.
Oh yeah, I wouldn't argue with that. It is definitely a big thing to have a support system.
So that's a preventive care measure. Should the government force you to go to church? Because it's a preventive care measure. And if you don't, well, then should the government say, oh, well, you could have, we could give you antidepressants, but, going to church, we've seen that most people that go to church maybe are less depressed. By the way, I don't know if that's an actual thing or not, but more social individuals, I think, tend to be less depressed. And so people who go to church probably are less depressed. So moving forward with that assumption, should the government force people to go to church or be able to use not going to church as a, quote, pre-existing condition, unquote, that would disqualify you from some treatments because you didn't partake in enough of a preventive measure?
See, church is interesting because you would associate church with religion.
Oh, really?
I know! And there are a lot of people who don't have a religion. So because I'm not religious, I do not have a church, even though I do have a support system. Would I then have problems getting medical care because I don't go to church? But I still have a lot of those similar benefits.
In this particular case, yes. And so, this religion is a complete other topic that we cannot get fully into now. But I understand what you're saying. Let's just say a social group. Because, I believe you just joined a book club. That's a social group. That helps you socialize. Should your social interaction be a metric that the government can use as, well, you tried to partake in this preventive measure, therefore we will be more willing to give you resources to help heal you? Because you're at least trying to do preventive measures. And it comes back to what we were talking about earlier of the government should be able to provide you with or encourage you to take preventive measures in your health. And if you don't have preventive measures, then there will be certain penalties. Should those be on the books, or should they just be, hey, I tried to have these preventive measures and I can't afford antidepressants and I chose not to enter a social group? Should the detriments that come along with that be based on the decisions or based on rules on books?
Part of the problem with rules on books is that they would be difficult to change.
Problem with government bureaucracy. Another argument against having government stick its nose in healthcare.
Right, because every day we are learning significantly more about how to treat things, especially around things that contribute to your healthcare but aren't health related, such as food security, homelessness, those sorts of things. And having rules on the books that are difficult to change will make it difficult to take advantage of those new non-healthcare things that can make your healthcare better.
Here's a question for you. Should the government's involvement in healthcare, because preventive healthcare is probably the biggest hidden benefit in reducing cost of healthcare, should the government's involvement, instead of being single payer, be to help include healthcare as part of public education and have that be the contribution, as opposed to the government deciding where money should go? Should that decision-making process of where should money go be left to charity, which means it's a distributed decision across all of society, meaning that society gains the benefit that they directly choose based on how much charity they're willing to give, and the government will subsidize, well, quote, subsidize, unquote, that decision-making power by increasing the likelihood that people will take preventative measures through the public school system.
I think that would certainly be a good way to go. While I don't necessarily love the idea of relying on charity, it is probably going to go over significantly better with a lot of people than single payer. And in the grand scheme of things, more education is probably going to help us a lot more in the long term with the money we have. Because if we take the time to educate people about basic preventative care, that can go a long way towards getting them into your regular hometown doctor's office sooner to catch things before they get expensive.
So should the government pay for resources to help connect people to healthcare institutions as opposed to paying for the healthcare institutions themselves? Because, yeah, that would be a bureaucracy, but it would be a directed bureaucracy of like, oh, you've come to us with this problem. This is the hospital that can help care for you, or here are the 3 hospitals. Here are the benefits that we've seen from them, and basically being kind of like a search engine for healthcare. Should that be government provided?
I think that would be great. It would be especially nice, too, if they could also include some level of the costs. Maybe not necessarily directly, hey, here's how much it costs, but give you a rough idea of, hey, here's the charities and write-offs they have available. Here's what kind of financial assistance. Do they accept Medicaid? That's actually a big one because it can be very difficult to find somebody that accepts Medicaid.
Because it's non-profitable. Usually it pays, for that particular example, it pays less than the actual value of the treatment, which is why when, at least recently at the time of this recording, when facilities have been asked if everyone that came through for these treatments paid Medicaid or Medicare amounts, what would happen? The answer is pretty much universally, we'd go out of business because it's not profitable. The resources that are available are scarce, and if you pay at government rates, it's non-profitable. It cannot be supported. It can only be supported by a surplus of money and generating more resources, which requires other aspects of society to bring them in. People will frequently point to the Scandinavian countries and healthcare there. The healthcare there is subsidized very heavily by the capitalist rules that they have. It is in many ways easier to run a business in the Scandinavian countries than it is to run in the United States because of the lax rules around business, because they needed to relax the rules around business to generate more resources to be able to pay for the huge healthcare systems in those countries. It's a problem that there are limited resources. You can't just say everyone has these resources because those resources are incredibly limited. So I to try and bring it back into what we were just talking about of the idea of education as opposed to providing care from as a capitalist system, yes, with the possibility of people benefiting from other people's misfortune, but at the same time helping them in that misfortune, which is why the hospitals are earning money, is because they're helping people. Reducing the cost of that by reducing the likelihood of people needing to use that care by properly educating people is probably the most efficient way that the government can spend their money. Even though it's not directly giving care to people, it is reducing the amount of care that people need. So education is probably the best solution. Would you agree with that?
Yeah, I think with what we've got, that's probably the best we can do.
So to kind of try and recap things, going back to everything that we talked about, we talked about death panels a decent amount, the idea that decreases the efficiency because you have to have a few people choosing what care people get. We talked about how to divvy up resources, who decides how to divvy up resources, what resources are available, how to decide where those resources go, who gets them, who would be the best benefit to get them. But regardless, what is the government's role? And I think that's probably the biggest modern question, is what is the government's role in paying for people, because they have the ability to take as much money as they want effectively and pay money, that it is probably best for governments to be involved only to the extent of educating people, because in the hospitals, while they want to benefit people by having them be healthy, they do technically make a profit on people being unhealthy. So relying on them to do that education doesn't make sense. They have a financial benefit to not educating people fully prior to them actually getting care, which means that is probably where the government should step in for the good of humanity to educate. And I think education is going to be a topic on its own. But it sounds like the best thing for the government to do, instead of paying for healthcare, is help educate people and connect people to the resources, particularly for preventative care, rather than paying for the post-event care, let's say, like after something already becomes a problem. Pay for education on preventative care as much as possible, and that should be the limit of government involvement. Is that fair, or have we missed anything?
I think that covers it pretty well.
Awesome. Well, I think that we may come back and revisit this topic if additional things come up. I know that we'll also be talking about abortion and a couple other related topics to healthcare and just life in general, equality of life, and who deserves what care. We'll be talking about that in other episodes, but I think for right now, that about wraps it up.
Hi everyone, thanks so much for listening to this discussion. Your interest really means a lot to us. If you want to help support this podcast and our goal of sparking discussions and bringing people together, check out how to contribute in the description. Happy deeping!